justice. Thank you so much for joining us. You can find us online on social media. You can find us at Twitter at Building Desire, at Instagram at The Counter Narrative, and on Facebook at The Counter Narrative Project. You should go ahead and visit us online at thecounternarrative.org. There you can join our mailing list. Make sure you join so you can stay in touch with everything that we have going on at the Counter Narrative Project. If you're joining us here on YouTube and we are live, even if we're not live, you need to make sure you hit the subscribe button. It's the red subscribe button. Hit that and make sure that you hit the thumbs up on this video to let folks know that you enjoy it. Also, share it with your family and friends.
Absolutely.
Let them know that you're watching the video and to join in on the conversation. So even if we're not live, you can always be part of the dialogue. So my name is Johnny Cornegay, and I am grateful to be the mobilization director for the Counter Narrative Project. And I'm joined with my amazing co-host.
I'm David Malbranch, and I'm a physician.
Oh, yes! David Malbranch is a physician. And we have a super special guest. I know you can already see him on camera. We can see him too. Who's joining us?
Jesus.
Hi, I'm L. Michael Gibson. I am founder and principal of the Black Bear Brotherhood. Welcome. Glad to be here.
Thank you so much for coming back, Michael. So here's the deal.
I keep wanting to call him Black Jesus. I was going to say, welcome, Black Jesus, and thank you for coming.
Welcome.
Because the radiant light behind your head. So welcome, Black Jesus.
So we're going to have a really important discussion. So this is actually continuing in our discussion about PrEP that we've been having over the last year or so with Revolutionary Health. There will be a link in the comments, or there'll be a link up here on the screen so you can take a look at our PrEP playlist and see some of our other shows. Mm-hmm. But today, as Michael mentioned, Michael is the principal of Black Bear Brotherhood, and we're going to talk about how PrEP impacts the Black Bear community, of which I'm kind of a part. Like, I go to some events and stuff, so I have some really interesting thoughts about this, and I'm excited about us having this conversation.
I'm excited about it too.
Yeah,
let's do it.
So first and foremost, we do this every show,
right?
Because we don't want to assume that people know what PrEP is.
Right.
So, Dr. Malbranch, can you please tell us what is PrEP?
Let me put on my white coat. Okay. So PrEP stands for pre-exposure prophylaxis, and basically with HIV, you have a pill right now with two medications in it. It's called Truvada. It's been used to treat as part of a treatment plan for HIV since about 2004, and since 2012 it's actually been approved. So if you're HIV negative and not living with HIV, you can take the pill once a day, and it will prevent you from contracting or being exposed to HIV. And when taken properly, one pill every day, it's about anywhere from 90 to 92% effective. Some studies have shown a little bit higher than that, but I tend to go with the 90, 92. It's not 100%, but it is there. I will say another thing about PrEP is that when we talk about pre-exposure prophylaxis, we talk about it being a program.
Yes.
So it's not really about just one blue pill solving all the problems. So PrEP is kind of a program where you follow up with a medical provider, you talk about your sexual health, you get STI testing, you get counseled, and you protect yourself against HIV, because in the future, we're going to have better and safer medications coming down the road. We're also going to have implants, injectable medications, infusions, as well as for women, intravaginal rings. And
amazing.
So, yeah, it's kind of amazing. So that's why I like to say PrEP is not a pill when people say PrEP is a pill. It is right now. That's the only thing that's FDA approved to prevent HIV. But in the future, it's going to be a whole different series of options for people, depending on what's best for you.
Mm-hmm. Can we, before we jump into the conversation, so the conversation about PrEP has evolved. We're seeing more discussion about it from kind of the inside. David, how have you seen the discussion about PrEP evolve?
I've seen it evolve a little bit because at the beginning, I don't think a lot of people were excited about it. People were distrustful of it. It's kind of like if someone were to say, you don't have cholesterol, high cholesterol, but take this cholesterol lowering medication, people would be like, why the fuck am I taking this anti-cholesterol or low cholesterol medication when I don't need to? And so I think for some people, they think, oh, well, why don't you just use a condom? Or why do I have to take a pill every day? Those kind of things. Or the other argument is around, well, you just want to take this pill so you can have sex without a condom, and you're a whore. And so those are some of the same things that were said when women were doing birth control back in the day. When birth control just came involved, people say, well, you want to do this implant or you want to take this pill once a day so you can have sex without condom and let somebody nut up on you. And it's just, it's kind of one of those things where it's archaic thinking. And I've seen over time since 2012 that people have actually become a little bit more accepting. A lot of us are a lot more educated, particularly in Black and brown communities. And so you'll see a lot more people talking about it, being talked about in a normative way. I still think there's a certain level of distrust. I still think there's a level of not really getting with the medical profession just because how fucked up the medical system is in this country, how racist it can be, how exclusionary it can be, how expensive it is, how inflexible it is for people. So PrEP falls under that. But I think more people are getting involved in it and starting to realize it's a good option for your sexual health. So if you want to use condoms, you don't think PrEP's for you, good enough. But if you think that one of these biomedical advances, right now just the pill, taking once a day is a good option for you, and you can combine that with using condoms or not using condoms, that's all on you.
Perfect.
As a provider, my attitude is like whatever's going to be best for you, and you get to choose.
Right.
And I just support you in that.
Michael, I want to bring you into this conversation. So when you first began to hear about PrEP or were introduced to PrEP, what were some of the things that you were hearing as well?
So I'm in the field, in and out of field or field adjacent, really, because I write grants for providers in this field to support the work. And I was aware of it, and very early on, I'm usually an early adapter to these types of technologies. On this one, I was on wait and see. I wanted to see. I waited probably about 4 years before I decided to get on it. I wanted to see whether or not any new data was going to come out that was going to contradict the other data that had already been available. I think that there's a natural skepticism just being Black in this country, aware of the kind of the medical apartheid activities that have happened on Black and brown bodies. But I also think just as someone who's been doing this work off and on since 1995, that sometimes we tell people information very emphatically based on the science we have available to us at that time, and then that information changes.
Right.
It was a very good example of that. We were emphatically telling people for a really long time that if you were living with HIV, that you had to use a condom each and every time, and now we know that that's not true if they're virally suppressed. So it's not that I don't trust the science. I'm a public health wonk. But I just wanted to see whether or not new data was going to come out to contradict the data that had been there. And so at a certain point, though, it became clear to me that I needed to get on it. I've been very candid with people that most of the people in my life who've seroconverted did so after age 35. And I knew that in my own behavior, I was exhibiting signs of condom fatigue. I was much more likely to just say, okay, let's go get tested. And then after we got tested once or twice, dispense with condoms. Even though I knew that there was a trust factor there and risk factors there, I've been teaching this again for over 20 years. Have been a safer sex poster child, literally on billboards, in campaigns. And so, and I took that responsibility heavy. I knew it would be different for somebody like myself to become someone living with HIV. And I knew I would be public about it and there would be a lot of disappointment. And so, for me, when PrEP became the option, after a certain point, it was just like, okay, this is going to work. I'm going to take it and we'll deal. And that was over 3 years ago.
So, Michael, I want to come back to a point that you just made. So, and David, I know you know this as well. So when I first began hearing about PrEP, like there was all this conversation about PrEP whores and like you mentioned, like you just want to do this so you can have raw sex, etc. Michael, was that a very similar, were people having those same reactions in your spaces as well?
I think the reaction I got most from friends of mine who were familiar with the work or were active in the field themselves was, well, you can still get other STIs, so why would you even bother with this?
Right.
And, my attitude was that, honest to goodness, the only STI I was worried about, and quite frankly was worried about more than I was worried about HIV, was herpes. I don't feel like we as a community have had a really candid conversation or reckoning with herpes anymore.
And it's funny that you say that, because we're actually going to do
doing
a
a show on that
herpes.
later.
Yeah, and for me, I guess a lot of my fear around acquiring HIV had diminished over the years of having seen so many people live long with it. I just didn't want to get it as an additional burden on top of the other things I already have to deal with as a black man in America. But I was very concerned about herpes. But the other stuff, I was like, I can take a pill or I can get on treatment. With HPV now, you can get a vaccination, up to age 45. Which I immediately got on the second that became clear and available. So, I mean, I know I don't want to diminish the reality that you can get syphilis. I know in Atlanta right now there's a syphilis epidemic among gay men, or that there's a slow but steady rise in drug-resistant gonorrhea. Those are real. But the reality was that I was exposing myself to those things even when I was using condoms, because I was using condoms for oral sex. So, my attitude was like, yes, I'm aware of the risk. I'm going to take a harm reduction choice here and say that, my primary risk is for HIV, and that's what I'm going to focus my attention on.
Yeah, and I think everything that Michael's saying, that's exactly why I think people get to choose, what they want to do, and they get to assess their own risk. Like, all my life, I've never been a condom police kind of guy. So as long as I've been doing work in sexual health, I've never been like, you should make sure you wear a condom every single time. Like, I've never embraced that bullshit, because I said, okay, look, here's the risk. Here's what things you can get from oral sex without a condom. Here's what you can get with anal sex. Here's what you can get with vaginal sex. What do you feel comfortable with? And I mean, truth be told, like, people talk about herpes and stuff, and you can still get other STIs, so you still need to wear a condom. Well, shit, herpes, HPV, and syphilis all can be transmitted even when you're wearing condoms, because it's skin to skin. So I kind of like the people who are the condom police. A lot of those people that are preaching a lot don't even fucking know how these things are transmitted, because it becomes such an ethical and moral thing to them, because it's been so ingrained in their mind. And I think your point is a good one about back in the day, we didn't have the science. All we had was behavioral prevention. We didn't have medications. So the only thing people said to do when folks were dropping like flies was, you need to wear a condom, because we didn't have effective treatments. And the treatments we had, we were killing people just as much as HIV was, and causing a lot of bad side effects. So we were all fucked up back then. And so the thing that you're seeing right now is kind of like the trauma, like not only with the baby boomers, but some Generation X, and then some generational trauma that leaks over into millennials and now Generation Z, where people have told them from jump, like, you have to wear a condom every time. And the message has to change in some respects. And it's got to be like, well, what do you feel comfortable with, and what do you like doing? Let me tell you what you're at risk for, what you're not at risk for. But what I want you to do is keep coming in to see me. This is me speaking as a provider. I want you to keep coming see me and talk to me about your sexual health, and I'll realize that shit changes. Your sexual behavior change. Your partners change. You grow. You decide different things at different times. So I'm going to be flexible with that. So you just roll with me and we'll be good from that. The problem with that approach is that I'm kind of a unicorn as a medical provider, because most medical providers aren't like that. They're, for lack of a better word, a lot of them are assholes and very, very judgmental. And I can tell you right quick, interesting story. We gave a presentation the other day to some medical residents and faculty about PrEP, pre-exposure prophylaxis. And part of the presentation was talking about taking a sexual history, using correct pronouns with transgender folks, not judging people, like putting away your implicit bias before you, because if we're going to have you talk about PrEP, we got to have you put all this away.
Right.
So one of the medical residents that did the presentation with us, she texts me afterwards, and this is a cis hetero white girl, and she says, oh, I got some feedback already, and she texts me the exact quote, which was, I don't think I should be forced to use the proper pronouns with transgender if I don't believe in transgender. And then the other person said, well, just because I don't agree with homosexuality doesn't mean I'm closed-minded. And so I remember it was like 2019. I thought to myself, God, what the fuck? And
Oh.
that's the reminder that even though we keep beating this drum, the majority of providers have that attitude. It's not breast cancer, it's not prostate cancer, it's not high blood pressure, diabetes, or heart disease. This is about sex. And when you're talking about sex, people have very religious and judgmental beliefs if someone is not engaging in similar behavior as themselves. So that tends to be it. But exactly what you say, Michael, is the way it should be, is that you get to decide what risk you're comfortable with. And so that's where I think the PrEP comes into conversation, because some people are comfortable with having sex without condoms and just being on PrEP. Some people want to use condoms in addition to PrEP. It just depends. But whatever works for you, as medical providers, we should be there to support it. I know I just said a lot.
No, and thank you. Okay, so I need to take a pause really quick, because for folks that are watching, I just am not okay. I'm not okay with people choosing not to honor the wishes of other folks. Like,
Right.
and this is really talking about who people are. Like, this is not like this arbitrary
It's not about agreeing.
thing. It's not about agreeing. This is who a person is.
Right.
And I'm just not okay with that.
Yeah, and the funny thing is that this also comes from a lot of Black and brown physicians and medical providers who are conservative. And so I kind of laugh at it. And I said the other day, I had to give a speech when I got an award at the GLMA conference in New Orleans. And I said, because I told them the story about those comments from the providers that got the lecture from PrEP. And I said, what's funny, as a Black same gender loving man, ever since I became a doctor in '96, I've never really had the luxury to cherry pick who my patients could be, or if they need to fall in line with exactly my religious and cultural beliefs, because I'm a minority in a lot of different aspects. So I have to deal with the heterosexuals because they're the minority. I have to deal with the white people because they're the majority. So it's just one of those things where I don't get to cherry pick, or else I don't have a job. And then also, as a physician, you took a Hippocratic oath. You're supposed to just do the work. You're not supposed to sit there and say, well, I don't agree with you. And so this idea, then how would they look and say, well, you're Muslim. I don't agree with your beliefs, so I can't treat you. I shouldn't be forced to acknowledge your religious heritage if that's it. And if truth be told, religion is a choice. Being transgender or being same gender loving isn't. That's just who the fuck you are. So I could really parse it out and splice it down and say, look, you could be judged just the same way, and people will hate it when someone's saying something that's anti-Islamic, anti-Christian. Like someone says, well, you know what? You believe in Jesus and you believe in Christ, so I don't really agree with that. And I shouldn't be forced to have to say stuff about God with you or have to support you on that level. What if I did that to people? That would fuck them up.
It would not go over. So I know that was, I wanted to take that moment because you brought that into the space, and I felt like that it was important to, as folks are watching and kind of taking this in, like raising the bar about what's acceptable and what's not. And that just was not.
And this science that we have about PrEP, I hate to be on a soapbox right now, but the science don't mean shit if socially we're still living in the 1950s and we're still acting like we're living, and we still have the same mentality as the 1950s. The science won't mean for shit. We could have a fucking cure for HIV. People still acting this craziness. It's going to be a problem.
Well, I think to your point, though, David, so I'm just coming off of a 5-city tour across Michigan with a group of Black gay men where we're educating brothers around the state about the new modernization law for HIV criminalization. And what we found in the conversations that we were having, because we were couching the criminalization conversation in one talking about how Black gay men have experienced the impacts of U equals U, PrEP, marriage equality, all of these rapid changes that have happened in the last 7 years that we've not taken a beat to kind of just absorb and think about what if all of that meant for our relationships and how we relate to each other.
Right.
And one of the things that came out, because we had some men on the panel who were living with HIV and some who were not, was that people were not, and this was from one of the younger men. I don't know if he's Gen X or Gen Z or millennial, but he's in his 30, 31. And so he was talking about the fact that no one really asks him about his status. He always brings it up. It's on his profile. People don't read his profile. And another brother brought up the fact that on the apps, most of the people are identifying in Michigan as either negative or on PrEP or both. Which
Really?
statistically doesn't fly, right?
Right.
Like statistically, they all can't be that. And then there were even like people who are living with HIV who were just saying that they were on PrEP,
Yes.
so that they could get past the conversation and bypass the conversation altogether.
Yeah.
And so I don't know. I think that we were asking questions around serial sorting and all of those types of things, and the general consensus was that the education level among the general population just isn't there yet. Like Equals You is not penetrated Black gay community yet. PrEP has to an extent, but even then, it's not fully understood. People just know to say that they're on PrEP, or if they do, they go get their blue pill, and they think that that's sufficient.
Right.
And then there's a recent study that just came out in the last year, in which Black gay men were acquiring HIV at a higher rate while on PrEP because they weren't having the kind of quality conversations they needed to have with their healthcare providers about the frequency of use, about what they were actually experiencing in their sexual practices. And just kind of poor health care that they were receiving even when they were on PrEP.
Yeah, and there was another study that spoke to the same thing, and it was basically talking about how a lot of Black gay men weren't actually disclosing their status honestly to their providers. So they actually kind of turned it and they said, well, maybe just people aren't telling the truth. And I was like, that's kind of dangerous because you're going to act like it's all Black gay men are just liars and uncomfortable with it. Instead of the take-home message from me is that maybe our systems don't make Black people comfortable and historically have not made Black people comfortable for very justifiable and heinous reasons. And maybe we should look at how we can change to make it more of a safe space so people do feel comfortable to tell the truth. But the way they spin it, and it's always through that like white researcher lens, whether they be gay or straight or whatever, is going to be, well, these Black people just aren't telling the truth, and so you have to make sure they tell the truth. And I'm just like, that's not the take home. So I don't know whether that study that you quoted actually became introspective to look at the medical profession.
It did actually. It was interesting in that it blamed low access to consistent health care, kind of episodic access, and just a lack of information. Like, some of the brothers weren't necessarily well briefed when they were first given. Often they had to take it, and what were the dangers if they didn't, or what they could do.
Right.
With my doctor, they were like, I was aware that I could double up if I had skipped a day on a day that I might be having sex, in order to at least increase the protection level. That kind of inside baseball information that they would look to their provider to provide or deliver wasn't coming from them. I know with my own doctor, I had to actually educate him. I have a heterosexual Jamaican straight doctor who in his 50s, who's amazing. He's completely like non-judgmental, which is why I go to him. But him and his nurses were not well aware of PrEP. I mean, and in fact, when I first asked him to go get on PrEP, he sent me to a clinic.
Wow.
That's happening a lot. Yeah.
And this is your medical provider, your primary care?
This is my primary care provider. And, Detroit, when I first got here 4.5 years ago, was just not hip. I had to have surgery, and I was, they saw that I was on Truvada. Literally, like 1 out of every 3 nurses, I had to explain that I was not living with HIV, but needed to still take this blue pill.
That happens in the pharmacy spaces too. The pharmacists are doing that too. When people go up, unless I write a prescription that says Truvada for PrEP, they'll say, and they've said in front of the patient sitting there waiting for their medication and other people around, well, this is an HIV medication and it's not enough if you're getting treatment. Like, this alone won't work. And the person's like, oh my God, why are you saying this in front of a whole bunch of people? But that's the kind of bullshit that people have to deal with in the other barriers. So again, it's not about the science all the time or the cause, but exactly what Michael's saying. It's crazy.
I want to...
I think the information gaps, I think we're in the field assume, because we're getting the information all the time, that's penetrating.
Right.
And it's not. And it's dangerous. It's dangerous where we are right now with that.
Can we talk about Black Bear Brotherhood, Michael? And, just in general, and kind of your experience in the Black Bear community. what are the conversations that folks are having around PrEP where you are, either at BBB or kind of in your community?
Well, I think with Black Bear Brotherhood, so Black Bear Brotherhood, for those who are not aware, is a social collective founded here in Detroit a little over 2 years ago, devoted to Black gay men of size, Black gay, bi, gender nonconforming, SGL men of size, and their allies, and recognizing that we needed a space where we could talk about our issues and be affirmed and celebrated, regardless of the bodies that we present in, or maybe even because of the bodies that we present in.
Yeah.
And so, one of the things that I think that the Black bear community is kind of experiencing a renaissance.
I agree with that.
And I think that that's they're good and challenging things with that renaissance, right? So, you have people who have been told that they were unattractive and unworthy and not sexy for a really long time, suddenly find spaces in which they are considered all of those things and are celebrating that. But there also comes a hypersexualization with that as well. And representations, this first time people felt like they could be naked and not they be a naked. This first time people have sex parties that they can go to that they're not going to be turned away at the door, and so they're having sex parties, and so all of that brings, while that's great from a body positivity, personal empowerment space, I think there's also heightened risk for STIs and HIV, obviously for those brothers as well, and maybe in a way that they hadn't really had to consider before this era, because they were largely, denied access to the same kind of levels of activity that you saw, with other brothers like Muscleheads or Twinks. Now these girls are getting in.
Yes.
So and rightly so. So I'm here for the celebration of it, but I also want to make sure that we're protecting ourselves and are aware of what our risks are, even as we're doing that. And with Black Bear Brotherhood, our chapters in Cincinnati, DC, and Detroit are all helmed by people or founded by people who have intimate knowledge around HIV, either through their personal living as someone living with HIV or as somebody who's been advocating in this space for a while. So we've been really lucky in that that's just been a natural part of the conversation, a natural affirmation of brothers who are living with HIV within the space, very easy conversations around PrEP. I do think, though, we're still working through brothers feeling comfortable. Like, they'll talk about their weight issues, which are very personal, a lot of harm and hurt and trauma there, but they still aren't comfortable necessarily coming out to the group around their HIV status. I personally know several brothers who've had private conversations with me within our membership who will talk to me about it. It gives me the safe space, and they know I've done this work, but aren't necessarily at a place where they're ready for the group to know about it. And it's interesting when I think about all the other things they've shared with the group that is very personal as a bonding experience. So I think we still have the stigma in the bear community that we need to address, the elephant in the room around it. And I think PrEP is a pathway to have those conversations without introducing judgment, right? I think so much of the HIV conversation is judgment laden.
Yeah, Michael, I was going to ask you, what do you think are the best ways? Like, for instance, I remember Jay was trying to get me to come to Big Boy Pride a few years back. And I couldn't go because I had another commitment. It was either a graduation or something. He tried to get me 2 years in a row, and I had a previous commitment, so I couldn't go. But he was really trying to, like at Big Boy Pride, have like a component of some health lectures, and not just around like being of larger size or obesity related or cholesterol related, like things that people would be like, oh, you're just kind of stereotyping here, but around like sexual health and about pre-exposure prophylaxis. What do you think would be the best way to kind of reach? Because I mean, obviously, the guys that are in the Black Bear Brotherhood at these different cities, it's kind of like a preaching to the choir audience, it seems like. But for the brothers that are just kind of on the internet in other cities and maybe more rural areas that don't have access to these support groups, like specifically with PrEP, how do we how do we reach out to them outside of kind of the general ways? You know, I've done promotional videos with the Kaiser Family Foundation around PrEP and other kinds of things around PrEP, but I do think there needs to be something targeted, because the context that you're saying, Michael, is very specific and something that can be very, I guess for lack of a better word, resilient and affirming about the recognition of, hey, you know, you finding your sexy back, or you're getting your sexy back. Remember to, you know, take care of yourself and take care of your health while you're getting your freak on, or something like that. Are there initiatives that are going on, or where do you think the needle should be moved towards? Like, what kind of venues or what kind of spaces, or how should these things be delivered?
I know for us, I mean, we conduct quarterly community events here in Detroit, and we purposely put off the topic of HIV until May, which was like after we had done a whole year of quarterly events. And part of that was because whenever we talk about Black gay, the very next sentence is HIV, right? Like, for brothers in this city to constantly be referenced to HIV was problematic. And so we wanted to make sure that we were acknowledging, particularly as a group that was devoted to men of size, that we were talking about a whole being and a whole person. I mean, like, if you go to our website, you're going to hear, there's like a section on where to go buy clothes for big boys. There's music, there's podcasts you should be listening to, sci-fi and games you should be playing, because we're more than our bodies, right? And so I think that the way to introduce a PrEP conversation, the way we did it was to incorporate it into how are you dealing with love and dating and marriage and apps. Like, we couched it in a larger conversation with how you live in. And I think that part of how you destigmatize HIV is to make it a normal part of a conversation about all the other things that you're confronted by and dealing with and having to contend with as a Black man in America. And you know, and I think in other cities, you know, having conversations about vulnerability and making PrEP and making HIV part of a larger meta conversation about how are we vulnerable to each other, which can talk about violence, which can talk about, you know, our communication or lack thereof. You know, I think that we've got to be more inventive. If you're just saying we're going to have a PrEP town hall and expect people to show up, you're gonna get people to show up, but it's going to be largely people who are already well invested, already know this message, might drag a friend or two to come listen. I think whereas if you have a conversation about, you know, how has Pose dealt with our issues as a Black gay community and what's changed since the years that Pose talks about, then you can have a conversation about PrEP and it's related to something that people are popularly interested in. But I think that that's the way you have to do it. You know, whereas at an event like a Big Boy Pride and things like that, as with all prides, they have workshops and sessions. I don't know how well attended they are, but they have, you know, so I think you still have to have them. You have to still show the, you know, people doing a little bit more than just taking up to the beat. But I think that these workshops and those things matter. But I just want people to be a little bit more creative about it. You know, we're over 30 years in this epidemic. If you're of a certain age, you've been hearing about Black gay men and HIV so much, it becomes like the thing that makes your eyes glaze over.
Right.
You know, even though we have all this new information, right, and all these new tools that are coming down the pike, injectables, 6 months worth of PrEP in the system. Though I personally, I think we have to have a real conversation about whether or not people are going to remember every 6 months to go back to their doctor to get on an injectable.
So, you know what? Actually, I think this is a good point, and I know that we're running a little longer for this one, but I think this is really important.
Okay.
Because to that point, one of the things that has been talked about now, so there's Descovy. And David, I wanted to ask you, what is Descovy and what should we be expecting from it?
And that's a great question, Johnny.
Thank you.
So Alvin keeps going like this.
Yeah,
we're just gonna keep
I know we're running
going.
long. I know we're running long, Alvin.
Because I have something to say, Alvin. So Descovy is basically, it's kind of the newer and improved version of Truvada, right? So one of the medications in Truvada is called tenofovir. So the older version one of the drawbacks is that it's a low risk, but a lower risk of kind of it gets into can cause damage to the bone over a long period of time or irritate the kidneys. So what this new Descovy drug does, it has a safer version that's actually a prodrug of tenofovir in it. So the old school version, 90% of it goes into the bloodstream and then gets to the T cells and prevents HIV that way. This new medication, it doesn't become activated. 90% of it doesn't go into the bloodstream. It actually has to wait until it gets into the T cells. And then when it gets into the T cells, it becomes active form, and then it prevents. That means that only 10% is actually in the bloodstream that's getting to your bone, getting to your kidneys, getting to these other areas. So it's purported as a much safer version. And the FDA had a subcommittee that gave a review of it or stamped approval that based on the studies, they found it's just as effective as the old version of Truvada, and it's just as safe, if not safer, as far as kidney and bone issues are concerned. And also we're using Descovy to actually as part of the treatment. It's the backbone for a lot of treatment for HIV right now. So the FDA committee actually, they didn't fully give it approval yet, but they said that from the studies, it looks like it's going to be good and recommended for men who have sex with men and transgender women.
Okay.
They said that with a caveat because the studies are primarily MSM and transgender women. They don't have a lot of cis women. They don't have a lot of different diversity in cultures and ethnicities. So people are there's kind of an asterisk with this kind of subcommittee meeting. So the full FDA approval hasn't come out yet, but that's probably going to come out in the future. And so I think what will happen, and to Michael's point, and also to some of the tone that we've talked about today, is that when we talk about pre-exposure prophylaxis, we should talk about it as a program instead of just a pill, because people are going to have different options, whether it's the injectable, and I think it's 2 months. Did you mean to say 2 months, Michael? Because it's every 2 months that...
on our tour, it said it was 6, so I was like, "Oh wow!"
No, it's actually 2 months. It's 8 weeks that it's supposed to be for the injectable, and it's also being touted for treatment as well. So it's going to be used for people living with HIV and then also as prevention. But it's every 8 weeks or every 2 months that's supposed to be out. But it's going to be all these different things, and I think what we have to do, those of us who are in the field and have been talking about this for years, we have to realize that not only are older generations not always getting it, but the younger generation, like, we can't get fatigued. Because if we get fatigued and we say, oh God, I keep saying this shit all the time, why aren't people getting it? Then the people that haven't heard it before will never get the message. But you can understand that's why the need to kind of pass it on and make sure there's younger people that are fresh, that are energetic, that want to give this message and also can connect with their own generation rather than the older fossils like constantly going around, because not only do we get burnt out, but then people don't feel like talking about it anymore. They get disgruntled and they think that people aren't listening. So all these things can happen. And I think we need to continue to have this conversation, not only because newer versions, safer versions are coming out, but because the younger generations that are coming up didn't live watching people die from HIV. They didn't see people getting whisked into the hospital. They didn't see the obituaries full with gay men where, you know, you'd see somebody at a party one night and next week you'd be like, where's so-and-so? And they'd be like, oh, they died. And so that's not their reality. Their reality is like, oh, I got HIV and I'm going to take this pill and blah, 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 blah. So there's a lot less people who are dying right now. So the culture has completely changed. And we just have to, the old school kids that have been there for a while and been through that trauma, we just got to change with it. Unfortunately, a lot of the baby boomers are really stubborn. Generation X, we have a certain level of stubbornness. And
I ain't stubborn.
Right.
Thank you.
You know, to your point, David, and I know Alvin is probably like heads exploding.
Alvin's like,
go
this.
ahead.
Right, I know, but I'll be really quick, Alvin. I can't see you, so I don't have the pressure. So I think that, you know, when this epidemic first hit, we were doing things like comic books and live theater shows and poetry readings.
Absolutely.
And I think that in order to kind of marshal this information in digestible forms that large groups of people are going to be able to receive, we've got to go back to the storytelling and narrative and media functions of marketing and sharing this kind of information. I think the expectation that it's going to be enough for testers and physicians to be the ones that are going to share this message is foolhardy and short. I think we have to get creatives back involved Because you're right, like, you know, and you have to get it where people are. People are playing video games and they're watching anime and they're reading comic books, and you know, and a huge part of our community is part of also the geek community. So I know, especially for the Bears. So I think that we've got to be inventive in those ways as well.
Yeah, thank you so much for that, and I think that's incredibly important. And I feel like there's another conversation to be had about creatives in the HIV movement. That we're going to put a pin in that. I want to thank everyone for joining in for this particular show. We have covered a lot on this show, and that is amazing. And so, a couple of things. Make sure that you hit the subscribe button and make sure that you hit the thumbs up button to let folks know that you were here and that you were watching, and make sure that you share this show. Also, go ahead and make sure that you follow the Counter Narrative Project on social media. We're at Building Desire on Facebook. We're at the Counter Narrative Project, and on Twitter, we're at Building Desire. Facebook, the Counter Narrative Project, and Instagram at the Counter Narrative. Michael, where can folks find Black Bear Brotherhood?
BlackBearBrotherhood.life, because we give you life, baby.
Yeah! Thanks, everyone, for joining us for Revolutionary Health, and we will see you next time. Bye.
Bye.